Hi, this is Angela Brown, Unit 7 Journal. So, the case study um, used cognitive behavior therapy. Uh, and so, it was a young lady, a 32-year-old Afghanistan war veteran, and she has been experienced PTSD. And so the therapist used cognitive behavior therapy with her, CBT, and it included 10 sessions of therapy. And she was given worksheets where she would keep track and monitor her events and thoughts about the events that occurred and also the consequences of the feelings. And the worksheets were basically to help sensitize her to the events and feelings. Um, so she used a Socratic dialogue uh, to talk to the patient. Uh, so how I can use CBT in my clinical practice in the future is I would have to first become certified, because you have to be trained in that area in order to successfully treat the patient and have successful outcomes. Also, um, you can use DBT for various things. DBT is basically trying to change the negative thoughts that the patient has, which is causing their, in her instance, PTSD. But you can use it with patients with PTSD. You can use it with patients with anxiety, panic disorders. You can use it with patients with depression. Um, you can use it with patients who just have stressful events in their lives, uh, patients who suffer from bulimia, nervosa, and nervosa, or even patients who's addicted to nicotine. It's it's a lot of basically patients that have these negative thoughts, and it's causing these negative unwanted outcomes in their lives. It just basically changed the way that they think. They're thinking negative. If you're thinking negative, you're going to feel negative. Your actions or behavior is going to reflect your thoughts. um, in my current clinical encounters, I really haven't seen CBT used thoroughly. I've myself, and I've seen others kind of hit on it or whatever. But as far as someone really using the CBT, um, I honestly have not seen that. Like I said, I've just seen like bits and pieces taken from it, a lot of motivational therapy or whatnot. Um, and I actually, when I talk to the patients, clients, I, try to use some of the things that I've learned from CBT, but of course I'm not certified. So of course I can't use it where it's like effective 100%. Um, let's see. Describe my experience with CBT sessions. That's basically my experience. I don't, yes and no, they use it, but basically, my preceptor do touch up, try to assess how things are going, and the patient talks about the DBT or whatnot and how it's helping. And they have journals or worksheets or whatnot that they do bring into the office. But that's basically it as far as the CBT. I think it's a good tool to use, and from what I've read, it's it's very helpful and in achieving positive outcomes with these patients with the negative thoughts, changing the negative thoughts to positive thoughts, and negative behaviors to positive behaviors. And that is it. Thank you.